Good morning and welcome everyone to our virtual membership plenary at our 31st Annual National Leadership Forum. We are thrilled to once again host you at our annual membership plenary, and we're so excited that each of you has tuned in to this very special discussion where you can help us thank General Dean for his years of service to CADCA and give General Price a warm welcome to his new role as CADCA's CEO. I'd like to take a moment to thank all of our members and member coalitions for the amazing prevention work that you've done in your communities this past year, especially in these challenging times. This plenary is our way of saying thank you to all of you for working with us here at CADCA and for the work you do in your local communities every day. It does not go unnoticed, and we appreciate you. Like everything this past year, our membership plenary looks a little different this time around, but we believe we put together an exciting discussion for you all for the next hour. I'd like to start out by quickly introducing you to our awesome membership team. My name is Reiko Mendoza, and I'm CADCA's Vice President of Business Development and Membership, and it is my pleasure to serve you all, along with my wonderful colleagues, Amy Pica, our Director of Membership in the CADCA community, and Lauren Blackwell, our Membership Associate. Lauren is new to the team, having just joined CADCA in 2020, so some of you may be seeing her picture for the first time. We're pleased to welcome Lauren, and we are happy to assist you at any time. Our contact information is listed here, and please reach out to us whenever we can be of service to you. One of our core member benefits is the CADCA community, an online forum for members to network, share resources, and learn from each other. This past year has presented many challenges, but we've been so impressed with how our members have stayed connected to one another through the community and how much you have stepped up to help one another in this pandemic environment. These highlights from the community really demonstrate the results of your efforts. The community has 13,000 plus members, more than 5,000 threads, and over 500 library items. Please check it out. There is something there for you. It really is an incredibly robust resource, and your contributions have made it that way. So thank you. Now, we'd like to acknowledge some of our members whose contributions have helped to shape the community this past year. These slides show the top 10 contributors in 2020, and we would like to do a shout out to the top 3. Our third most frequent contributor was Gwen Hessen from the Community Action Commission of Fayette County in Ohio, with 28 posts in the community. Our second highest contributor was Nancy Pasquale from Barrye L, New York, with 31 posts. And drum roll please, our number 1 contributor to the community in 2020 was Elizabeth Dare from It Takes a Community, also in New York, with 44 posts. That is almost 4 posts a month. That is amazing. Thank you so much to Elizabeth, and thank you to all of you for your contributions. As a small expression of our appreciation, the membership team has sent all top 10 contributors a Visa gift card. We hope you enjoy the gift card and continue making the most of the community this year. And if you're a new CADCA member or you'd like to utilize the community more fully moving forward, please reach out to Amy. She'll be happy to show you how to navigate the platform so that you can be recognized as a top contributor at next year's forum. In addition to contributing to and receiving information from the discussion threads on the community, CADCA membership also offers you a wide variety of additional benefits. Some of these include our state reports with customized annual survey data for state members. Please note that the 2021 annual survey is now open. Please look for the link and take this survey. The more members who participate in the survey, the better data that we have and the better we can serve you. If you haven't received the link yet, please reach out to our membership team and we will get you this information. We really appreciate your participation and we value your feedback. We also have special member perks, including community chats following our Wednesday webinars. The Wednesday webinars have been incredibly popular this year. As such, following the webinars, our members have been participating in post-webinar chats with our trainers. This benefit has been really successful, so please join the conversation in the community after our next Wednesday webinar. Additionally, our public policy team's advocacy efforts have resulted in the highest amount of DFC funding to date. This year, the program was funded at $102 million, which is really amazing and such an accomplishment, and a member benefit. And of course, we offer discounts of up to $200 per coalition member for the forum and the mid-year training events. That means with your membership, every person you register for forum or mid-year receives $200 off each registration. Please join now if you haven't, and keep a lookout for registration details to be coming soon for our Mid-Year Training Institute, which will be held July 11th through 15th. We really want you to check that out and sign up for it. CADCA is a membership organization and we owe so much to our members, so thank you all. If you aren't currently a member and you'd like to become one, or if you want to learn more about your benefits, please visit Amy and Lauren in the CADCA Corner today, or reach out to membership@cadca.org and we will be happy to assist you. And now we have what I call a really bittersweet but also amazing discussion for you all. As you all know, after 23 years as CADCA's chairman and CEO, and my boss for the last 8 years, we are saying goodbye to General Dean as he retires. And we are welcoming our incredible new leader, General Price. It's wonderful to have both of them here for an open and candid discussion about substance misuse prevention. And we are so excited that they are both here with us today. We asked you, our members, to send us some questions for the generals, and you delivered. Additionally, we hope to be able to answer some questions from everyone who is participating in this plenary. So please be thinking of your questions, submit them through the chat, and we'll get to as many as we can before our time is ending. Before we get to the first question for our members, I thought it would be great for them to hear how you both, General Dean and General Price, met and how you decided to join forces to ensure and continue the amazing work of CADCA and our work in prevention. So my first question is for you, General Dean. Can you talk a little bit about how you met General Price and why you knew his amazing leadership abilities would transfer so well to our coalition work and our prevention efforts?
It'd be my pleasure. Do I have about 2 hours to do that? But I will tell you that you may not think so, but General Price and I, about 67 to 85, so that's about 18 years different in starting our military career. And but fortunately, we ended up in the same portion of the Army, the same branch. And I had the opportunity as a fairly senior guy to observe the younger officers as they progressed through the Army. And General Price had met me in the summer of, I think, 1986 in Germany.
Yeah. Mm-hmm.
But I didn't know that he had met me, because we didn't actually introduce ourselves to each other. But I became aware of him as he progressed in the Army. And I won't give you the long story, I'll give you the short story. But, you know, in the Army, we watch young officers that are doing great things and having a wonderful career. And I noticed that several times he was promoted ahead of his contemporaries because of his outstanding performance. And just watched him grow in the Army and got feedback from other people about this young, bright officer by the name of Barrye Price. And we actually ended up getting to know each other after he had been selected by the Army to be a general officer. And he ended up at Department of the Army in a very critical position, where one of his responsibilities was managing the Army substance abuse program. That included many other things, but that was one of his items he was responsible for. So I thought that this young, bright general would be a great person to keep my eye on to see if he might be interested in coming to CADCA. So that lasted a few years. I invited him to come to CADCA to speak. He didn't realize he was being watched, but he did a great job there as well. He then left Washington and went down to a position that I had held. and he did great work there. So I went down to his promotion ceremony, and he thought I was coming down just to say congratulations. I was coming down to evaluate him and find out what he was doing in Fayetteville, North Carolina. So um, everything that I learned of him and heard about him led me to believe that he would be a great candidate for this position. So as he was about to leave Fort Bragg, and I knew the Army wanted him to stay, um, but I knew he had a young son. I gave him the opportunity to come join us in lieu of being reassigned and competing for the next star. And to my surprise, he said yes. And he came to CADCA and obviously did great work. And it was my pleasure to ask the board, and the board unanimously asked him, based on my recommendation, for him to join us at CADCA to become CADCA's CEO. And he's off to a great start as well. So I could tell you a lot more, but the bottom line is I was looking for someone highly educated, great experience, a great orator, got along well with people, would know how to interact at the national level, international level, the local level, the state level. And he fit all those bills and has proven me to be correct. So I'm very pleased.
Thank you, General Dean. That is such a great story. So now I'll turn it to you, General Price. We here at CADCA have all had the pleasure of working with you for the last 4 years. But what initially attracted you to CADCA's important work?
Well, thank you for that question, Reiko. And I would tell you, contrary to General Dean's story, I met him when I was a lieutenant in 1986. We were in the same room, and he was walking by with an entourage, and he never noticed me. So that's the rest of the story. So my attraction to CADCA was really the invitation by General Dean to join you at Forum of February of 2014. I was the keynote speaker at that time. And one of the things that attracted me back to CADCA is I was amazed by the number of volunteers that were here in the dead of winter. You know, while school was in, the day after the Super Bowl, all of these people, 2,500 people, were in a room, and to learn that they were mostly volunteers was absolutely impressive. Fast forward 2 years later, 2015, 1 year later, my college roommate died of 30 years of addiction to crack cocaine. He had experimented with crack cocaine my last semester of college and was addicted. And so he, after my presentation at Forum in 2014, General Dean asked me to consider becoming his executive vice president and COO. I kind of took it as something, maybe I'll do it, maybe I'll be a Beltway bandit, maybe I'll run another kind of company. But then my roommate died in October of 2015. And I couldn't help him. I had no skills. The only thing I had was just say no, which I had learned from Nancy Reagan in the 80s. And so because I couldn't help Carl, I thought about this opportunity at CADCA and came back to General Dean and told him in May of 2016 that I'd be honored to join the team at CADCA. And I'm here because I couldn't help Carl, but I figured by my service here at CADCA, I'd be able to help scores of other young people who are similarly suited as Carl. So that's my story.
Well, thank you, General Price. And, you know, we are all sorry to hear about your roommates. And on another note, I remember you coming and speaking at the 2014 plenary,
Wow.
and you were fantastic. I actually spoke to you afterwards a little bit. You and I talked, and little did I know I'd be talking to my new boss, but we're so excited that you're here.
Small world. Thank you, Reiko.
So thank you both so much for these questions and these answers. Let's get to our first question from our members. General Dean, the first question is for you. This question was submitted by Lennora Tia Pierrot of Jessup Wagon Drug Prevention Coalition in Alabama, and their coalition is a 3-year member of CADCA.
General Dean, General Price, we love you here in Alabama. General Dean, we would like to know who are some of the most memorable people and experiences that you have had in your 23 years at serving us in drug prevention at CADCA?
Lennora, thank you for the question. Thank you for being a wonderful leader in this field. And I've enjoyed seeing your smiling face with your family at our training events over the years, and that will be missed. But you're trying to get me in trouble with that question. It's a great question, but you're trying to get me to single out people. And what I'm going to say to you is that the number of coalition members and leaders that I've met have been unbelievably great people. And I feel somewhat embarrassed to start singing them out. But I would simply put them in a category and say the coalition leaders have impressed me significantly, and I'm certainly going to miss them as well. But I will say that I've met some wonderful friends internationally as well, and they get a lot done with very little resources and very little dollars. And we've been in 30 countries around the world, and there's a wonderful leader in each one of them that's doing great work, and we built a lot of international coalitions as well. And then I would say to you, there's been an unbelievable number of federal, corporate, and private partners that have contributed significantly. And if I might just mention one that I met shortly after I got to CADCA, and he came onto the board and served for about 18 years, I think. And that's Neil Austrian. Neil was the president of the NFL when I met him, and he became a great friend, and his wife, Nancy. He came onto the board and he helped us find humanitarians for our Drug-Free Kids campaign dinner, one after another, and raised lots of money, provided great leadership. And I would say he is the kind of board member that any organization would want to have. But there have been many others as well. But to keep the answer short, I would say, though, that Neil had a good friend by the name of Jerry Roach, and Jerry is the late Jerry Roach now, and he was out in New York as well. So the two of them really got my board off to a great start and contributed in a mighty, mighty way. So I'm going to miss some wonderful corporate leaders, some wonderful private and federal leaders, and I'm going to miss, in a significant way, the wonderful coalition leaders like you all across America. So thank you and thank them.
Thank you for your question, Lennora, and thank you, General Dean. You really have had some incredible experiences over the past 23 years, and I'm sure it was difficult to focus on just a few, but we appreciate hearing your answer. General Price, the next question is for you. This question is from Megan Moore from the Partnership for Health in New Jersey, and their coalition is a 2-year member of CADCA.
Hi, my name is Megan Moore. I'm the project coordinator for the Partnership for Health Drug-Free Task Force in Hunterdon County, New Jersey. My question is for General Price. General Price, as more states legalize or decriminalize substances, how do you think prevention strategies will change?
Thank you, Megan, for that question. I believe that we, CADCA, must meet people at their point of need. Hence, we should help those who are fighting to keep marijuana off the ballot and equip those who are fighting legalization within their states. We should also have strategies and a playbook with options for those states who have passed legislation for medical marijuana and work to prevent the passage in those states for recreational use. With respect to those states who now have recreational use, we should help those localities with opting out policies. We should also ensure that we do everything to protect and insulate our youth, and ensure that ordinances, regulations, and policies for responsible distribution are in place in those locations. Thank you very much for that question, Megan.
Thank you, General Price, for sharing your insight on that. And thank you, Megan, for submitting such an important question. General Price, the next question is also for you. This question comes from Dennis Trask of Human Service Center in Illinois, and their organization is a 5-year member.
General Price, thank you so much for your years of service to our nation, first in the military, and now more recently in a leadership role for CADCA. I'd like you to consider the future, maybe 5, 10 years from now. At that point in time, what would you like to have as memories of CADCA's success in those 5 or 10 years? memories of people and events that helped CADCA have an even greater influence on making our communities better places for people with less of the terrible impacts of drug misuse?
That's a great question, Dennis, and thank you for that question. I would love to see a greater number of coalitions attending both forum and mid-year. These venues offer the latest and greatest in prevention and evidence-based research, and it refreshes our coalitions to better do their work locally. I would like to see our membership rolls quadruple. Membership, like American Express says, has its privileges, and there is tremendous strength in numbers, especially on Capitol Hill. I'd like for CADCA to become a $50 million organization with its own charitable foundation to help us with expenses. I'd like for the words primary prevention to become synonymous with CADCA, much like saran wrap is synonymous with plastic wrap. I'd love to see greater collaboration with our governmental partners, the field, and with our corporate partners. I'd love to see a DFC grantee within every community across the United States. I would love to see a DFC-like program internationally. I would love to see our international footprint become as robust as our domestic footprint. And finally, I'd love to see pharmacies throughout our nation co-dispensing drug deactivation pouches when they dispense opioids, benzodiazepines, stimulants, and hypnotics. Thank you very much for that question, Dennis.
Dennis, thank you so much for such a great question, and thank you for providing such a thoughtful answer, General Price. Our next question is for you, General Dean, and this comes from our good friend, a member of our Coalition Advisor Committee and longtime CADCA member, Marilee Fowler. Marilee is from Matt Force in Arizona and has been a member of CADCA for 11 years.
Hello, General Dean and General Price. This is Marilee Fowler from Yavapai County in Arizona. First, I want to thank you for your service to our nation and for your service to prevention. You are both my heroes. In Arizona, we are experiencing an epidemic of overdose deaths from illicit fentanyl pills. In my rural county of 215,000 people, we have had 9 teenagers die from fentanyl pill overdoses, and approximately 50% of our overdose deaths in 2020 are from counterfeit fentanyl pills. My question for you today is, what are you hearing on a national level regarding this illicit fentanyl problem? And what do you see are the solutions that prevention can implement to address this tremendous problem affecting our communities and our youth?
Well, Marilee, thank you for that very thoughtful question. But before I get to your question, I want to thank you for your leadership locally and your leadership serving on the CADCA Coalition Advisory Committee. You have provided us great insight and great guidance, and we really, really do appreciate your leadership. You have asked a question about an issue that is troubling all of us, illicit fentanyl. You might want to see it as poison because it's available on the internet. People are ordering it and receiving it in unmarked packages. It is creating habit because it can be added to almost all types of drugs. You don't know the amount that you're receiving. It is very deadly. It is, in fact, killing people, as you indicated, in your community. Nationally, we are working with the Drug Enforcement Administration, our friends at Office of National Drug Control Policy, and obviously, as you know, with our coalitions to help them bring some guidance to this issue. I would say first, we all need to continue to raise the issue at every location, making people aware how deadly this is and how readily available it is, unfortunately. Secondly, I would say the coalitions, you need to work with your sectors in your community and make sure that they all are fully aware of this as well, as we will do with our partners at the national level, like our friends at the National Institute on Drug Abuse, our friends at the Drug Enforcement Administration, and many others. I would just say that we all got to continue to work this, make all of our leaders fully aware of it, and do all that we can to cause those that we're responsible for in our communities and in CADCA across the nation aware of this poison, I would call it, that's available readily available. And we ask you to keep us appraised of what you are learning locally. And we ask the other coalitions to do that as well. And hopefully working together, we can find some solutions and try and prevent the many, many deaths that this is causing. So thank you for your question.
Thank you so much, Marilee, for addressing this critical issue and bringing up this really important question. And thank you, General Dean, for your really measured and thoughtful response on this. Our next question is for Emma Beal, a 3-year member from the Substance Abuse Prevention Coalition right here in Alexandria, Virginia. And General Price, you're on deck.
Hi, my name is Emma Beal, and I coordinate the Substance Abuse Prevention Coalition of Alexandria in Alexandria, Virginia. My question is for General Price. What has impressed or surprised you the most about how prevention efforts have adapted in response to the COVID-19 pandemic?
Well, Emma, thank you for that very thoughtful question. And as I've noted in the past, though our focus continues to be on illegal and illicit drugs, underage drinking, and cessation of tobacco use, we know that you can overlay our coalition model over any scourge within our nation and will achieve tremendous results. COVID has aptly demonstrated our coalition's flexibility, adaptability, and versatility. Let me offer one case in point. The Sunnyside United Coalition from Sunnyside, Washington, a small community of 16,000 in Washington State, focuses on far more than drugs, tobacco, and alcohol. They are doing gang prevention, English as a second language, building strong families, offering child care support, offering laptops during this COVID environment, food, clothing, child and mental health services, and they even focus on building and nurturing strong fathers within their community. That's the power of coalitions. And Sunnyside is not an exception. That really is the rule, not just in the United States, but in our coalitions around the world. Thank you for that question, Emma.
Thank you for posing that question, Emma. The pandemic has presented so many unprecedented challenges, but we have seen the most amazing and successful pivots in response, and you're one of them. So thank you, and thank you for sharing your perspective on that, General Price. So our final question is for you, General Dean. It comes from Jose Pierrot of the Compass Coalition in Puerto Rico, and their coalition has been a member of CADCA for 8 years.
Good morning. I got a question for General Dean. Sir, you have dedicated your life to service, first in the United States Army, and then helping our communities stay safe and healthy. I know it is almost impossible for you to just pick one thing, but if you could say, what do you think you will miss the most from working with community coalitions around the nation?
Jose, first of all, let me thank you for your leadership in your home country and here in the mainland, and for serving on CADCA's Community Coalition Advisory Committee. You bring wonderful insights, and we appreciate your leadership, and thank you for that. So I think it's not as difficult of a question as you might think. And my answer may be a little surprising to you, but my answer will tell you why I have been at CADCA for nearly 23 years. And it's working with people like you. I believe that our coalitions are led and the membership of them are the best people in America that only have the best interests of their communities, and they work so diligently, many times without the resources they need and the leadership they need. But in spite of all that, they have made tremendous progress and have had wonderful successes. And if CADCA was a think tank that only did research around this issue, but not operational, meaning it was out in communities all across America and for the last 10 or so years internationally, then it wouldn't be as much excitement as it is. So I would say that I've had wonderful staff members at CADCA, had great board members, great coalition advisory committees, wonderful partners, but the heart and soul of what drives me every day is my work with community coalitions and their members, and to see them getting so much done with so little. So I want to congratulate them and tell them that they are the reason why I've had this wonderful, very long, exciting journey. So thank you for the question, Jose.
Thank you so much, Jose, for that great question. And General Dean, your answer is not surprising at all. We love our members, and our members love you as well as the team does here at CADCA. Thank you for your service and your contributions to the field. We will miss you greatly.